What's going on with the healthcare debate? Like many of you, I'm wondering, isn't it time to separate fact from fiction? My name is Dr. Elia, and I realize health issues are not an easy topic to discuss. Recently, I watched in amazement a video from a gentleman in Texas by the name of John C. Crawford, who made some very serious statements about government takeover of the healthcare systems in America. He makes comments on the conduct of people at town hall meetings, death counseling, the ARP, the AFL-CIO, the insurance companies, and how Congress has introduced in the health bills communist ideology and socialist principles. So this video is addressed to you, Mr. John C. Crawford, and to those who watched Mr. Crawford make a plea to his representatives not to pass the health care reform bills presently in Congress. They, like me, need to know what is fact and what is fiction. You state, Mr. Crawford, that the bills in Congress will result in the government takeover of the healthcare system. You also state that the health bills will result in the government getting between you and your doctor. The only thing which at present is getting between you and your doctor is the insurance companies. They deny claims which your doctor prescribed simply because they are costly. The reform bills will not allow the insurance companies to deny you a claim based on pre-existing conditions or that it is medically justified. How can anyone assume, let alone come to the conclusion, that this constitutes a government takeover or worse, getting between you and your doctor? Second, you praise, Mr. Crawford, those who attended the town hall meetings and succeeded in disrupting them as patriotic Americans who are exercising their First Amendment rights. When is it American, let alone patriotic, to shout over others when they speak or to prevent them altogether from expressing their opinion? Is that your understanding of exercising one's First Amendment rights? You believe, Mr. Crawford, that the 46 million Americans who do not have health insurance presently may not have a health policy, but they have health coverage because they have access to an emergency room. Access to an emergency room does not treat a chronic illness or provide you with critical drugs to survive. And what about the thousands of dollars those who do carry health insurance have to pay to cover the cost of the use of emergency rooms by those who are uninsured? Should we ignore 46 million Americans just because they can't afford to pay the exorbitant cost of hospitalization and drugs? Let's talk about death counseling. You state that the bills in Congress will have doctors provide death counseling instead of providing regular medical advice such as liver transplant or hip replacements. First and foremost, no bill in Congress requires anyone to receive death counseling if they don't seek it. We have death counseling at present. We get it from our doctors or members of our family. It's free and voluntary. The bills provide death counseling to those who request it by qualified people should they need it. And for doctors who should be counseling on medical issues, instead, are you under the illusion that if a doctor provides death counseling, they cannot counsel on other medical problems? What kind of doctors are these, Mr. Crawford? You tell members of Congress that they don't work for AARP, ACLU, the AFL-CIO, or even the trial lawyers. What does your statement imply? That the millions of Americans who are members of these organizations are any less American than anyone else? How can you deny them representation in a democracy such as ours, regardless of their political affiliations or religious beliefs? You claim the bills on health care must have been written in Russia because of their communist applications and socialistic content. I personally doubt that there are many members of Congress that have ever been to Russia. What surprises me more is that no one has yet made you aware that Russia has not been a communist or socialist country for decades. Perhaps instead of getting your news primarily from Fox, Mr. Crawford, you should try a truly balanced approach in coverage, not in slogans from CNN or MSNBC. Finally, Mr. Crawford, you warn your representatives that you will be watching them more closely in the future, and you will hold them responsible at the ballot box. I don't know who was watching who in your part of town, but for the rest of America, we were watching very closely our representatives. That is why in 2008, we said never again to the old crowd who gave us wars, economic crisis, and financial collapse. The American people were certainly watching, Mr. Crawford, and they voted for change in order to bring about a better life for all of us. The majority of Americans did exercise their right at the ballot box. Their voice was heard loud and clear. No more status quo in healthcare or energy or education or banking. They want change, and Congress, as the representatives of all Americans, is introducing these changes demanded by the American people and confirmed at the ballot box through legislation. The American people have spoken, Mr. Crawford. It's time for you to listen and learn.